Have you ever felt back pain that just will not go away? For many people, back pain is simply an annoyance, a result of poor posture, heavy lifting, or everyday strain. But for seniors, the story is often more complicated. Back pain can sometimes be the first whisper from the body that something serious is happening inside. In this video, we are going to explore the hidden warning signs of back pain that could signal a dangerous condition. You will learn when back pain is harmless, when it is a sign of normal aging, and when it becomes a red flag that requires urgent medical attention. By the end of this video, you will have the knowledge to recognize the difference and to act before it is too late. If you want to protect your health or the health of a loved one, make sure to watch all the way through, and don't forget to like, share, and subscribe so that more seniors can access these life-saving tips. Back pain is one of the most common health problems in the world. According to Harvard Health in 2023, nearly 8 out of 10 adults will experience it at some point in their lives. But while younger adults often recover quickly, seniors face unique risks. The American Geriatric Society has identified chronic back pain as one of the leading causes of disability in people over 65. This means back pain is not just discomfort. It can be a warning of disease, loss of independence, and even reduced life expectancy. So why does the aging spine cause so many problems? Science shows that as we grow older, the discs between the vertebrae begin to lose water and flexibility. They shrink and dry out, creating stiffness and pressure in the lower back. At the same time, bones become weaker due to osteoporosis, which dramatically raises the risk of fractures. Arthritis and inflammation erode the small joints that stabilize the spine. Muscles lose strength and tone, especially in the core, leaving the back with less support. These changes are a normal part of aging, but they make it much harder to know whether pain is harmless or whether it signals a dangerous condition. Doctors often say that pain is the body's alarm system. Sometimes the alarm is just a gentle reminder to rest or adjust your posture. But in other cases, the alarm is warning you of something urgent. The challenge for seniors is learning to tell the difference. One important clue is persistence. Normal back pain from strain often improves within a few weeks. But pain that lingers, grows worse, or interferes with sleep is not typical. In fact, a study in the Journal of the American Medical Association in 2020 found that seniors who ignored persistent back pain had a much higher chance of losing mobility permanently. Another clue is association with other health changes. Back pain that appears alongside weight loss, fever, or night sweats should never be dismissed. These combinations can point to infections, cancers, or systemic diseases. According to Hopkins Medicine, cancers that spread to the spine often begin with unexplained back pain long before other symptoms show up. Family members and caregivers also play a role. They may notice that a loved one moves less, avoids activities, or struggles to sleep because of back pain. Sometimes seniors downplay their pain, but patterns of decline are easier to see from the outside. When these patterns are visible, it is time to encourage medical evaluation. The good news is that science provides clear guidance on what to watch for. In the next section, we will focus on the red flag symptoms, the specific warning signs that demand immediate attention from a doctor. These are the moments when back pain shifts from ordinary discomfort to a sign of something much more serious. Before we continue, leave a comment below if you or someone you know has ever ignored back pain only to find out later it was something serious. Sharing your story can help others take their health more seriously. Part 2. Red flags that demand immediate action. So when exactly does back pain cross the line from discomfort to danger? Doctors refer to red flag symptoms, the warning signs that suggest a potentially life-threatening problem. These are not symptoms to monitor casually at home. They are signals that demand immediate medical attention. One of the most urgent red flags is back pain combined with sudden bladder or bowel problems. If someone suddenly loses control of urination or bowel movements, this could indicate cauda equina syndrome, a rare but severe condition caused by compression of the nerve bundle at the base of the spine. According to the American Association of Neurological Surgeons, this is a surgical emergency. Delay in treatment can mean permanent paralysis or lifelong incontinence. Another critical red flag is back pain accompanied by rapidly progressing weakness or numbness in the legs. If an older adult suddenly struggles to walk, climbs stairs with difficulty, or stumbles unexpectedly, spinal cord compression may be the culprit. The National Institute of Neurological Disorders and Stroke emphasizes that early treatment can mean the difference between full recovery and irreversible disability. Severe back pain that wakes someone from sleep or becomes worse when lying down should also raise concern. Ordinary muscle strain usually improves with rest, but pain that intensifies at night is suspicious for spinal tumors or infections. A 2021 study in the Lancet Rheumatology highlighted that nocturnal back pain in seniors always warrants evaluation, especially when combined with fatigue, fever, or unexplained weight loss. Persistent back pain after cancer treatment is another warning sign. Cancers such as breast, lung, and prostate frequently spread to the spine. Johns Hopkins Medicine reports that spinal metastasis often presents first as back pain, sometimes long before other symptoms appear. Ignoring this type of pain allows cancer to progress silently. Sudden, sharp back pain accompanied by chest pain, dizziness, or shortness of breath may signal an aortic aneurysm, a dangerous enlargement of the body's main blood vessel. The U.S. National Library of Medicine warns that older adults, particularly men with a history of smoking or high blood pressure, are at higher risk. Back pain caused by an aneurysm is not muscular, and if the artery ruptures, it can be fatal within minutes. Spinal infections, though rare, are another life-threatening condition. When pain occurs alongside fever, chills, or night sweats, it must be taken seriously. The Mayo Clinic describes spinal infections as difficult to diagnose early but devastating when missed. They can destroy bone, compress nerves, and spread to the bloodstream. Early detection through MRI scans and blood tests can save lives. Doctors also caution that back pain following even a minor fall should be evaluated right away. In seniors with osteoporosis, a seemingly harmless fall or even a sudden movement can result in a vertebral compression fracture. The World Health Organization estimates that 1 in 3 women and 1 in 5 men over 50 will experience such a fracture during their lifetime. These fractures cause pain, deformity, and loss of mobility, and significantly increase the risk of future fractures. The message from emergency medicine is clear: timing is everything. When back pain comes with neurological changes, systemic symptoms, or rapid deterioration, waiting is dangerous. Every hour matters in conditions like cauda equina syndrome, spinal cord compression, or spinal infections. Beyond the physical dangers, ignoring these symptoms can deeply affect quality of life. Seniors may lose the ability to walk, care for themselves, or maintain independence. Families may carry guilt for overlooking signs. That is why awareness and swift action are so important. The reassuring truth is that modern medicine offers many effective treatments if caught early. Emergency surgery for nerve compression, strong antibiotics for spinal infections, radiation for spinal tumors, and minimally invasive procedures for fractures are far more successful today than in the past. Early diagnosis can transform a medical crisis into a manageable condition. If you have ever experienced back pain that felt different or unusual, drop a comment below and share your experience. Your story might encourage someone else to take action before it is too late. In the next part, we will look at how doctors diagnose these serious conditions, what tests they use, and what treatments are backed by science to restore mobility and reduce pain. Stay with us. Part 3. Diagnosis, treatments, and final takeaway. When back pain becomes suspicious or shows red flag symptoms, the next step is always diagnosis. Doctors begin with a careful medical history. They ask when the pain started, whether it gets worse at night, whether there are other symptoms like fever, weight loss, or bladder changes. These questions may seem simple, but they guide doctors toward the right path of investigation. A physical examination follows. Doctors observe posture, movement, reflexes, muscle strength, and sensation in the legs. Even something as basic as asking a patient to walk on their heels or toes can reveal nerve compression. These clinical tests give doctors the first impression of whether the pain is muscular, skeletal, or neurological. Modern medicine then provides powerful tools to look deeper. X-rays reveal fractures, osteoporosis, or spinal deformities. MRI scans are considered the gold standard because they can show soft tissues, discs, tumors, infections, and even tiny nerve compressions in detail. CT scans offer highly precise images of bones and joints, while bone density scans detect osteoporosis early. Blood tests can identify infections, inflammation, or cancers that affect the spine. Together, these tests help doctors uncover the hidden cause behind the pain. Once the cause is clear, treatment depends on the diagnosis. For compression fractures due to osteoporosis, bracing and medications are often used, but in severe cases, minimally invasive surgeries like vertebroplasty or kyphoplasty restore stability. If infection is the cause, strong antibiotics, sometimes delivered through IV in the hospital, are essential. Spinal tumors may be managed with surgery, radiation, or modern targeted therapies designed to shrink cancer cells without harming healthy tissues. When nerve compression threatens mobility, emergency surgery can remove the pressure and restore function. For less urgent cases, physical therapy, anti-inflammatory drugs, and supervised exercise remain powerful tools to reduce pain and improve independence. One of the most encouraging findings in recent research is that early intervention almost always improves outcomes. The Mayo Clinic reports that seniors who receive timely treatment for spinal infections, tumors, or fractures have significantly better recovery rates than those who delay care. Harvard Health emphasizes that combining medical treatment with lifestyle changes, such as strengthening core muscles, improving posture, and eating an anti-inflammatory diet, can dramatically reduce long-term disability. So what should seniors and their families remember? First, never assume that back pain is just aging. Pain is the body's alarm system, and ignoring it can allow serious problems to progress silently. Second, act quickly when red flag symptoms appear. Time can mean the difference between recovery and permanent disability. Third, know that effective treatments exist with modern imaging, skilled surgery, advanced medicine, and supportive therapies. Seniors today have more hope than ever before. Beyond the medical side, the emotional impact cannot be ignored. Seniors living with untreated back pain often feel isolated, frustrated, or dependent on others. Families may struggle with guilt or worry. By recognizing the signs early, seeking care, and following science-based treatments, families can preserve not only health but also dignity, independence, and quality of life. If this video has helped you, please like, share, and subscribe. It is one simple way to spread vital health knowledge to more seniors around the world. And before you go, leave a comment below. Which warning sign surprised you the most? Sharing your thoughts may inspire someone else to take their back pain seriously, and that could make all the difference in their life. Back pain does not have to define aging. With awareness, early diagnosis, and proper care, seniors can continue living active, independent, and fulfilling lives. Thank you for watching, and take care of your spine, because a strong back supports a strong life.